Hi, we're the Note Ninjas, your OT and PT duo, and we're here to show you creative activities to do with your patients with documentation. So for this one, this is working ambulation, functional mobility, changing our plane of movement. So there's all different activities we can do with this. We have some TheraBands laid out. You could also have one of those agility ladders. You can use tape on the floor. You can use a lot of different kinds of things. So to start basic, Nicole is just going to step over, step 2 pattern over the line to increase her step length. And she can really focus also on heel strike. The next one she's going to do like normal walking, alternating right and left. To increase her step length, again, she's going to work on the heel strike and good posture. The next one she is going to do is sidestepping. And this can help her get up in and out of the shower. It could also help with the abductors for balance, for strengthening, for stability. And those are all the different things you could cue and then write in your documentation. Next, she's going to step backwards. A lot of our patients are scared to step backwards. However, backwards stepping is huge to decrease fall risk. And how many times do you have to take that step backwards in order to reach something in your kitchen or the bathroom? So many times. So you can do step 2, Gait, or you can do every other, which is definitely a lot harder. Ooh! And again, if she needed physical assist, you would just document that and showing your skill. This next one is super hard, but it's cross steps, but it's also really fun. She has the step. This is really good for reactive balance, fall prevention, and just an upgrade to her balance activities. This is fun, all different ways you can do it. And again, you're going to just document. How did you progress? What cues? Did you give her a tactile cue on her core for balance? Did you tell her to look straight ahead? Did she need the physical assist? Whatever you did that shows your skill is what you need to put in your documentation. So make sure to follow us at the Note Ninjas for more engaging patient-centered activities with documentation examples.